Welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Michelle Wargo. We've got a lot of information in this month's episode. If your student plans to play sports at school, you'll want to stay tuned for important information about physicals from a local specialist. A local emergency department is getting a boost. You'll find out why it's important to you. And could the back-to-school schedule be bad for your health? We'll explain. We begin with information about a new treatment that can help treat potentially deadly blood clots. Florida Hospital Waterman is the first in Lake County to utilize this new ultrasound technology, which allows a patient to receive less medication in a shorter amount of time, resulting in better outcomes. Affecting 1 in every 1,000 Americans annually, venous thromboembolism is the third most common vascular illness.
When people have clot in the veins in their body, including their legs and their upper extremities, the clot can propagate and become more extensive as time goes on. Eventually, some of that clot can get into the heart and into the arterial system supplying the lungs. That is bad.
Dr. Simon says new technology that utilizes the power of ultrasound waves allows hospital treatment to be reduced significantly.
The ECHOS device is utilized to help break up clot essentially. It transmits certain frequency ultrasound waves that help to break up, or more precisely help to separate the fibrin, which is the glue in clots. And when it helps to separate the strands of the fibrin, it allows the medicine that we inject through it some sort of thrombolytic. When medicine gets into the clot, it doesn't spread around the body as much, so therefore it works on the clot more quickly. The ECHOS device is utilized on people with deep venous thrombosis, which is the clot that is either in the veins of the legs or the arms that can spread into the pulmonary arteries. When people have clot in the legs or even in the arms, and the clot is blocking flow, the arms and legs swell. They can become very taut and even affect the arterial system. People that have this disease need to have some relief, and the only way to do that is by getting out a lot of this clot. Certain diseases have an increased risk and give people a greater tendency to have DVT. People who are sedentary, people who have cancer, may have trauma and have injuries to the veins. They tend to accumulate clot in the veins, and the return of flow from the limbs back centrally to the heart doesn't happen.
You can learn more about the treatment for deep vein thrombosis and find a specialist by visiting watermanwellness.com. We know wrong lifestyle choices can contribute to many medical conditions. Unfortunately, many people do not practice the good habits which can lead to better outcomes. Experts cite a number of reasons for the growing number of people with heart disease, obesity, diabetes, and other common conditions. They attribute it to our often hectic schedules that seem to make it hard to make healthy choices.
A lot of us are in a hurry, and it takes far less work and effort to get a bad meal than it does to get a good meal. You typically look at individuals in fast food restaurants, and it is rare for them to order a healthy meal or a salad, because you can eat a bad hamburger or a bad sandwich far quicker than you can actually eat a salad.
Yet, even when diagnosed with a medical condition, doctors say some patients don't heed their advice.
I think the challenges that we as doctors face with medical treatment is really compliance. Men are much more difficult in trying to maintain compliance with medication. I forgot to take my pill, I was on the road, I didn't take my pill. And then if they perceive in any way, shape, or form that that pill may provide a side effect, they're much more likely to stop the medication without even telling you. And you won't find out for months that they actually have stopped the medication.
Following doctor's orders and adopting a healthy lifestyle is important and attainable. Bridget Jackson of Tavares is proof. Jackson has changed her life dramatically after chest pain last year sent her to the emergency department and then surgery.
I was always go, 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 constantly on the run, even work and personal life. and would work late at night. I don't buy any processed food. I went to a nutritionist. I read the labels. I cook at home. I cook fresh. I mean, you have to make that choice. But I have to choose life. I mean, if I don't do it this way, if I don't think of me and take care of me, I'm not going to be around, and I'm not ready to leave.
There are some reports out there that state 91% of a person's life and health is related to their own self-management. That only 9% is related to a physician's office or their encounter in a hospital situation. So when we speak about really having an impact on overall health for our community, it's imperative that we encourage people to take responsibility for their health. And one of the biggest things they can do is begin to move regularly and have that kind of activity that assures that they will have a longer life, a healthier life, a happier life.
Visit watermanwellness.com to find specialists in this episode who discuss healthy lifestyle changes with you. And you can learn about upcoming classes and events that will help you make healthier choices by visiting the Conry Creation Health Center website. Emergency care in Lake County got a big financial boost recently thanks to generous members of the community. The Florida Hospital Waterman Foundation's annual gala, held in March, raised nearly $120,000 to fund emergency department services. Last year, 61,000 patients visited the emergency department, and they benefited from state-of-the-art technology available because of fundraisers like the gala.
One of the great things that we've utilized in patient care over the past few years is the use of ultrasound by the bedside. We oftentimes can make point-of-care decisions at the bedside to help us diagnose and to treat immediately. We have here at Waterman a 64-slice CT scanner, which can take pictures of important parts of your brain and your body in literally seconds. We have diagnostic and objective data to help us make point-of-care decisions when we need to, very quickly. And I've worked in many other hospitals in the system. Here at Florida Hospital Waterman, we're very efficient. Our processes are in place. I'm very happy where we practice, and I'm very proud of our team.
According to Dr. Pattani, the emergency department has seen a 5 to 10% increase in patient volumes each year. He says the continued community support helps ensure exceptional patient care continues. A new specialist in the Lake County community is excited about advanced cancer care that is available locally. Dr. Anudh Jain recently joined Florida Hospital Waterman's radiation oncology staff, bringing a wealth of expertise in more targeted treatments that can lead to better patient outcomes.
The other interesting advance in radiation oncology is stereotactic body radiotherapy, which delivers a highly focused radiation dose to small tumors. And again, that can be very effective against tumors while limiting normal tissues. And this is often done in a series of only 3 to 5 treatments.
Dr. Jain says it's treatment like this that should reassure Lake County residents that they likely won't need to travel to larger cities for advanced care.
They virtually have all modalities of cancer treatment available to them. They have a highly coordinated physician team that can provide the best care.
You can find information about the wide range of cancer treatments, plus helpful resources for patients and their families by visiting fhwatermancancer.com. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. Chef Dave and Stephanie will join us in the Conry Creation Health Center kitchen with an idea for an easy and delicious after-school snack. A Eustis pediatrician explains why sports physicals are so important before your child begins after-school activities. And you'll learn about an outpatient procedure that can ease hip pain, especially for athletes. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. First, Waterman Wellness has information about community support groups that can help you or a loved one. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Michelle Wargo. Our next story provides insight into the cause of hip pain that may plague even the most active among us. Doctors say some people have a condition developed during a person's younger growing years where the hips are abnormally shaped. Because they don't fit together perfectly, the hip bones rub against each other, causing joint damage.
In the past 5 to 10 years, we've found that there are deformities of the hip called hip impingement that are likely early precursors of arthritis and cause what is people know as labral tears of the hips. And more recently, we're able to arthroscopically reshape the hip to, one, lessen the pain from labral tears, and we can actually fix the labral tears as well. The typical patient is someone that is younger, active, has groin pain, meaning pain right in the middle of their groin that is sharp and sort of intermittent with certain sporting activities, and that just doesn't seem to be getting better.
Dr. Birchka says an outpatient procedure is available to help patients get back in step.
You go into the hospital in the morning and you leave the same day. It's done through 2 incisions, maybe the size of the end of your pen, and we insert a camera into the hip and use special little instruments to reshape the bone and repair the labrum with stitches. You go home the same day. You start with physical therapy in about a week. You're on crutches for about 2 weeks, and then therapy for 2 to 3 times a week for about 4 months afterwards. Return to sport is about 5 to 6 months.
If you or a loved one experience chronic hip pain, you can find a Florida Hospital Waterman specialist to help identify treatment options by visiting fhwatermanortho.com. If physical activity is in the plan for your children once school begins, you'll want to schedule your student for a sports physical. Like many school districts, Lake County requires that students get a physical examination by a doctor if a child will participate in school-related sports. It is not meant to replace the annual wellness exam your child should have every year, because experts say the sports physical has a specific purpose.
A sports physical is an evaluation of your child's mobility, ability to participate, and for how long they're able to participate. If your child has chronic medical conditions, whether asthma, seizures, or heart disease, or any hearing impairment, visual impairment, you want to make sure that your child is safe while he or she is involved in any sports.
You can visit watermanwellness.com to find a specialist to schedule a sports physical assessment for your child. When your child gets home from school or sports activities, she'll likely be hungry. Next, we visit the Con Recreation Health Center kitchen to learn an incredibly easy snack that will satisfy anyone's discriminating taste. Back to school can be a tricky time of year for parents with picky eaters. So we have with us today Florida Hospital Waterman Executive Chef David Atkinson, and we also have registered dietitian Stephanie Bassett here to save the day. They're going to tell us about a wonderful meal that can be a breakfast, a lunch, or a snack. What are we doing today?
We have a crunchy apple wrap today.
Oh, that sounds delicious. So what goes into this crunchy apple wrap?
Well, we have a Granny Smith apple that we've shredded on the grater, and we've added a little lemon juice to keep it from turning brown. We have creamy peanut butter, granola with raisins, craisins, nuts, almonds, whatever kind of granola you can find at the store. And then we have grapes as a little side item.
So what makes this a healthy after-school snack or lunch or even a breakfast?
Well, it's a really great source of protein. We're using peanut butter, which is an excellent source of protein. It's also a really good source of fiber and heart-healthy omega-3 fatty acids.
Now, if you're allergic to peanuts, can you do almond butter or cashew butter?
Yes. Peanuts are our major allergen, so you have to be careful of that. But you can also use your almond butters, cashew butters, just like you mentioned. Those are perfectly acceptable as well.
Okay, and what's good about the apple?
The apples are a really good source of fiber. That's why it's best to keep the skin on them. As long as they're washed properly, they're great to use. So we just grated it on a cheese grater.
Oh, okay.
We're just going to sprinkle on our granola. We're gonna fold the edges in and then just roll it up. Put our little bunch of grapes. That's perfect lunch for any kid.
If you'd like the crunchy peanut butter and apple wrap recipe, visit watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the September episode right here on Lake Sumter TV for some of the following stories. You'll learn about advances in treatment for prostate cancer that mean quicker recovery and fewer side effects for patients. Our focus on healthy aging will look at osteoporosis, its prevention and treatments. And we'll head back to the Connery Creation Health Center kitchen to learn a breakfast recipe that's perfect for busy mornings. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Michelle Wargo for the award-winning Waterman Wellness.